Civil society organizations, CSOs in Nigeria, have been actively involved in advocacy efforts related to health to address various challenges and improve healthcare access, quality and equity in the country.
On the 7th of November, we, the community health practitioners of this country, witnessed, like all other citizens, the presentation of the 2018 appropriation bill, which was laid by the President of the Federal Republic of Nigeria on the floor in the joint session of the National Assembly. After last year's experience of budget delay, we commend government for this early budget. But there is a bigger problem. This problem is that the 2018 health budget, as a proportion of the total national budget, is only 3.9%.
Some of the key advocacy areas and initiatives undertaken by CSOs in the realm of health in Nigeria include universal health coverage, maternal and child health, nutrition and malnutrition, infectious disease, mental health, health system accountability, emergency response and pandemic preparedness, access to medicines, and primary health care strengthening. Nigeria hosted and signed the 2001 Abuja Declaration, in which African governments committed to allocate at least 15% of government spending to health.
Our recommendations on funding is to allocate 15% of the total annual budget to the health sector in compliance with the Abuja Declaration of 2001. Where not possible, start with a minimum of 7.5% of the budget, being 50% of the Abuja Declaration, for the allocation in 2018, and progressively increase by 1.5% until the 15% is attained by 2023.
The primary goal of the declaration was to improve healthcare systems, access to healthcare services, and overall health outcomes on the African continent. 22 years later, Nigeria is still far from achieving the target set by the declaration. In addition, Nigeria has several policy documents that allude to quality, effective, efficient, equitable, accessible, affordable, acceptable, and comprehensive healthcare services for all Nigerians.
What we want to do is to bring health to the doorstep of our people. And the only way to do that is to deliver health through a network of functional PHCs.
Yet, Nigeria still ranks very low on the World Bank's Human Capital Index 2020. According to almost all health metrics, Nigeria's health outcomes are dismal, with inadequate progress made over the past 2 decades for the majority of its population. As of 2018, the share of government spending assigned to healthcare was only 5.2%, according to Lancet Commission. A report by the non-profits of the Partnership for Advocacy in Child and Family Health at Scale analyzed the budgets of the Federal Ministry of Health and its agencies between 2001 and 2021. Its findings show that Nigeria neglected to follow through on its promise, oftentimes barely reaching 1/3 of the pledged target.
Many countries continue to consider health as a luxury or as a consumption good. It's something that is costing the government money, whereas it should have been taken like an enabling factor for economic and socio-economic development.
In a world where quality healthcare is a fundamental right, millions of Nigerians, especially across vulnerable communities, still struggle to access the care they need. But in this struggle, there are unsung heroes, civil society organizations leading the way.
No woman should have to die while giving life.
Using the example of the efforts of Nigeria Health Watch, a non-governmental organization working on providing relief and development assistance to underserved communities in the areas of healthcare.
Every life counts, as we go extra mile to ensure that no patient died due to lack of financial means.
According to a survey carried out by the Nigeria Health Watch, 19% of maternal deaths globally occur in Nigeria. One Nigerian woman dies every 13 minutes. That is 109 women dying every day from preventable causes related to pregnancy and childbirth. These are only recorded deaths. Nigeria is yet to have a system that allows it to record maternal deaths that happen in the communities where women do not go to a health facility to give birth. Aware of these worrying figures, the Nigeria Health Watch launched a program across 6 states in Nigeria, one per geopolitical zone, to gather evidence on the prevailing factors responsible for maternal mortality in rural communities across Nigeria.
The Nigeria Health Watch team was in Ebonyi State recently to learn how one primary healthcare center is helping change this narrative of the community of Odenibo in Ikwo local government.
Ebonyi State was a state selected in the southeast with Odenibo community as the beneficiary community. A study to determine the causes, trends, and high level of maternal mortality rate revealed that hemorrhage was the most common cause of maternal death in the community, accounting for 23%, given the distance of the community from Abakaliki, the state capital. With a commitment to build the maternal health ecosystem by extending primary healthcare services to remote areas, with a particular focus on safe motherhood, maternal and new health, Nigeria Health Watch, in collaboration with the Ebonyi State government and support from Ananda Marga Universal Relief Team, a private international voluntary organization founded in India, partnered with the primary health facilities in Ebonyi State to operate comprehensive maternal and child care centers. Nigeria Health Watch model of community-based collaborative healthcare proved effective, with over 1,965 successful births taking place in the supported health centers.
In Ebonyi State, we are currently in 5 local governments: Abakaliki local government, Oahupu local government, Ebonyi local government, Ikwo local government, and Onitsha local government.
In Ofia-Oji alone, another community in Ebonyi State, 85% of the women come to the health center for delivery. This is remarkable, given the majority of women were given birth at home or with a traditional birth attendant. In pursuit of Nigeria's commitment to advancing nutrition through a multi-sectoral approach, the Federal Executive Council on the 3rd of March 2022 approved the 2021 to 2026 National Gender Policy. Although the policy commits Nigeria to a bolder and more ambitious vision for gender equality and the empowerment of all children, adolescents, and women, there exist gaps in these policies, particularly in addressing the nutritional needs of non-pregnant, non-lactating women and adolescent girls. To address this gap, the civil society scaling up nutrition in Nigeria, CSOs, has taken a proactive role in collaborating with the Federal Ministry of Women Affairs to develop and adopt a national guideline on women and girls' nutrition empowerment for optimal development. CSOs, a non-profit organization working on the health of children in Nigeria, and other civil society organizations working with vulnerable or hard-to-reach populations on health initiatives.
What we do majorly is, because we are concerned even about that particular child and also at the mother, and most of the times also for the father. So we go through probably to the government and we keep on talking and talking. Most times we organize several programs that probably that brings in the government probably on decks. We talk to them, we educate them probably on what stunting, wasting, underweight, breastfeeding is, and so that if they are already built into what it is, or they will find it in their own place to put it in their own budget. While we talk about budgets too, we try to advocate to the government to, for the very, very first time, create a budget line for nutrition, and which most states in Nigeria now, most especially in Lagos State now, already have a budget line for nutrition where they can start talking about this is the amount that is going for nutrition. And so when they are doing that, that gives us probably another kind of solace. So while we have that also, we are now already in another space again where we now do budget monitoring. So we now monitor all these particular funds that they say that is already into the budget line for nutrition. So in doing all this, we are in that space where we advocate for nutrition. We are in that space where we tell them what to do probably for nutrition. And we are also in that space to now monitor what they are doing for nutrition. So we are trying to see everything all encompassing, that we see that everything that talks about health and nutrition is taken into cognizance.
Over the years, CSOs' health programs, initiatives and strategies have been instrumental in reforming policies to meet the needs of disadvantaged and vulnerable populations. They have continued to collaborate with government agencies, international organizations, healthcare providers and local communities to advance their advocacy goals in the healthcare sector, which have contributed to shaping health policies, improving healthcare infrastructure, and ultimately enhancing the health and well-being of Nigerians.